So if we look at the public is the government, but the most important in healthcare especially is the people themselves, because they are the funding of the system. The privates who have providers, producers, and we have the investors who put their money in these providers and producers. We shouldn't forget them. And partnership is built in general by mutual interests, shared values, trust, profits, and risks. This is a very important perspective because we look on partnership usually from a public perspective. If we look at from the other way around, a partnership is an arrangement where entities or individuals agree to cooperate to advance their interests. So these have interests and these interests, and they're cooperating together to share profits and risks. It's not a tool to transmit profits and risks. So not that the government want to give the private sector the risk and the profit, or not the private sector want to transmit the risks on the government and holds the profit for itself. This is one mistake also. No, it's a sharing process. And any relationship should be built on mutual trust. But in healthcare in general, it's a very unhealthy relationship. Why? Because mutual lack of trust. You can feel it even here in the room. You can feel it. If you look like how the discussions are, you can feel this mutual destructive criticism. Just like everyone is blaming the private sector, blaming the government not being efficient, not being transparent, being corrupt, and the government blaming the private sector for being bad. Mutual negative branding. So in general, you lack trust in this branding of both sectors. Mutual lack of transparency. Whenever I went, you don't have any information about things even within you're involved within the government itself. So within the private sector, I worked for a private hospital, I worked for the Egyptian government before the revolution, and I could not get any information.